Welcome to Fat Science. I'm Mark Wright, along with Andrea Taylor and Dr. Emily Cooper. Great to see you two.
Hello.
All right, on the show this week, we're revisiting a topic that we've covered about a year ago called endocrine disruptors. And the reason that this is important is that there are a massive number of chemicals in our environment that mess with our body. I don't, as you could tell, I don't have a medical degree, so I just said mess with our body. But these are chemicals that interfere with what our body is doing. So, Dr. Cooper, I guess we need to set a baseline for, why is this an important topic and just what the scale of the chemical environment actually is.
Well, I think it was close to 100 years ago that the scientists first saw a connection between the chemicals that were being introduced into our environment and our hormonal system. And so it's been known for a long time that certain chemicals that we're exposed to can affect our hormones. And that means that they could affect the output of these hormones. They could affect the way that the hormones interact with our body. They could affect their blood levels. And that's very important because our endocrine system regulates so many things that any kind of disruption there could lead to metabolic diseases. It could lead to things like diabetes, obesity, cardiometabolic disease, fatty liver disease, dementia, and now they're even seeing a connection to cancer risk because the endocrine system plays a role in cancer as well. And so that's why they're so important. And I mean, the scale of it is just enormous. And so it's a little bit mind-boggling to even address it, which is, I think, why I kind of feel like our whole society is sort of in denial, or I don't know, we're kind of like bury our head in the sand about it because the solutions just seem so unattainable.
And I think that, when you look at the obesity and diabetes epidemic that we're facing in our society today, so many times I hear people just focus on refined foods, that the reason that this epidemic is taking place is that we're just not eating enough whole grains. And what I have not heard hardly ever is people address the chemical environment. It's estimated that something like 7 new chemicals are invented every day. And over the past century and a quarter, something like 85 to 100,000 new chemicals have been introduced into the environment. And we don't even know what a lot of these do. Some of them we have identified as carcinogens, and there has been some regulation, but getting control of the idea that some of these are endocrine disruptors and may be contributing significantly to the diabetes epidemic in our country. I'd love your thoughts on this, Dr. Cooper. I just can't imagine it's coincidence that we're, getting obese, more and more obese every year. And it has to be tied to this chemical environment in some way, correct?
Oh, definitely. Experts know this. And yet every time there's a discussion about obesity or diabetes, if endocrine disruptors are mentioned, it's sort of like a little afterthought or a little like asterisk, and also endocrine disruptors. I think it just needs to be taken to center stage, really, because it is that important. And it's so far-reaching, it turns out, the impact of these endocrine disruptors. Because one of the scary things to think about is that if we are exposed to these endocrine disruptors in our chemical environment today, and we go on to conceive offspring through something called translational genetics, it's basically transferred to the next generation, all of the endocrine disrupting alteration of our genes. And so now the next generation is going to be vulnerable to those same endocrine type related dysfunctions and diseases, and their offspring also, even if they're never even exposed themselves. And so this is so far reaching and it's so extensive. It's like, if you think about the chemicals that you're mentioning, the number of them, we need chemicals in our society because the way that we operate. And so there's a role for chemicals for sure, because we couldn't do many things that we like to do without them. But the point is that we should be testing these chemicals to find out how they impact our health and how they impact the health of future generations. And that right there is really not being done. And that's the concerning point, and it's not being discussed and part of any of our conversation about why are we having the diabetes epidemic increasing, the obesity epidemic increasing, these cancers that we're seeing in young people, and dementia and Parkinson's, and so many degenerative diseases. What if the endocrine disrupting and our chemical environment is really playing an enormous role there instead of a minor role? Because if you think about it, when they have examined, say, cord blood of babies, the umbilical cord blood, they're finding like 99% of them have 300 chemicals in there at levels that are thought to be like toxic right away when the baby's born. And out of those, a large number of them are known to be endocrine disrupting. And we don't even know which chemicals are endocrine disrupting because the testing hasn't been done. But the studies show that out of those 300, at least 40 are known to be endocrine disrupting. So now that's getting passed to the next generation. And when that little baby grows up and has children of their own, it's going to be passed to their children too. The impact of it will be passed, whether or not they're exposed in their lifetime to those chemicals. And guaranteed, because of the way that we're headed, they'll be exposed to more, not less, because we're not doing anything to really understand the extent of the problem or come up with solutions of how to mitigate it. And so this is why it's such a big topic, and something that even though we want to bury our head in the sand, we're back here again trying to communicate a little bit more about it.
And we should make sure that people understand that these chemicals, it's not just from food, because I think you sometimes don't think about, like, chemicals come from furniture, from makeup, from hairspray, from like baby toys, from blankets, from all kinds of things that, like, from your phone, from anything basically that's processed and created. And you don't think about that when you buy products, from the packaging that the products come in, and anything that's plastic, and I mean, even metallic things, everything has some sort of processing these days. And while it's all amazing and incredible that we make all these amazing things, sometimes progress isn't so progressive, And I mean, I know that, like, personally, I try and make everything, so organic and great and wonderful. But, there are a lot of things that you're like, oh, God, this is not really the best thing for me, but I love it. It does great things. But some things are really harmful.
I'd love to dig deeper, Dr. Cooper, about the complexity of the endocrine system. So something like 50 key hormones are circulating in our body at any one time, and they do all kinds of things to regulate sleep and reproduction and metabolism and blood sugar. And it's just this really, really complex chemical signaling network. Give us an idea of, if we look at metabolism specifically, how important the endocrine system is.
I mean, the endocrine system is so key in metabolism. So we refer to it as the neuroendocrine system. So that's the connection between our hormonal system and our nervous system, and all the instructions that come through that come from our hormones as messengers to our nervous system and our brain. We also have like nervous system connections from our gut that are related to those gut hormones, the incretins, and how they signal throughout our system by interacting with our nervous system. So, it's very, very complicated. But if you think of it, it has to do with all of our, as you mentioned, Mark, the hormones that regulate our insulin, our thyroid levels, our reproductive hormone levels, even our inflammation. And so that's hormones coming out of our body fat, out of our stomach, out of our GI tract, out of our brain and our hypothalamus, our pituitary gland, our gonads, our adrenal gland. I mean, all of this is, regulated by the endocrine system, and it's responsible for maintaining normal body temperature, our energy levels, reproductive function, as we said, glucose and insulin regulation, all of that. So it's so critical. And, so many times we're sitting thinking, well, why is this happening to my child? Or why is this happening to my family member? Why am I starting to develop elevated blood sugar levels or abnormal insulin levels? Or why did my weight just start going up for no reason? There's so many times where people are just so puzzled with what's happening, like why? Because they're not able to relate it to something, obvious in their lifestyle that could have triggered anything. And sure enough, these chemicals, we're living in a chemical environment, and they are coming from all those places that Andrea mentioned. And, even here we are sitting in front of computers that tend to have, flame retardants that are coming out at us. And,
Diodes.
yeah. And there's also like a false sense of security, thinking I'm going to buy organic, so that's going to prevent me from, it's not necessarily so at all. And so we're left with, what do we do about it? And how do we identify who's vulnerable? How do we really move the needle on this? And maybe the awareness is where it needs to start, so that people always push back when there's discussion of these different diseases. It's like, well, what about our chemical environment? How's that impacting it? And then people will, say, oh, yeah, that's right. Yeah, we forgot to mention the chemical environment.
Yeah.
And,
But I think that's why we're doing this, is because we saw that, we need to start thinking about it again and bringing it back to top of mind.
Yeah, for sure. We'll get into sort of what the checks and balances are in discovering endocrine disruptors, but I'd love to just have a little bit more of an explanation, Dr. Cooper. So these chemicals can disrupt in a couple of ways, right? They can mimic the hormones in our body to create an artificial response or a negative response, but they can also block the receptors too, right? Is that what we mean when we specifically say disruption?
The disruption can be so multifaceted. So it could be either that they mimic our hormones, that our body recognizes them as our own hormones, and so it starts to obey their instruction. And that may not be what your body is supposed to be doing at all. So that's one aspect of the disruption. The other could be that they actually prevent our own hormones from functioning normally. They interfere with our own hormone function, and they disrupt our endocrine system that way. Or they interfere with the manufacturing of some of our hormones by our cells that are responsible for manufacturing them. They can interfere with the receptors that receive the signals from the hormones. So it's not just one thing, one way that they disrupt the system. There's multiple different ways that they could. And so the different chemicals have different modes of operation. And so it depends on which ones we're looking at, whether they mimic our own hormones or they disrupt our hormone function. And so that's one of the things that needs to be done, because it's such a big job, because we have so many chemicals, and how to catalog the impact of all of those. Scientists really have a method of doing that, but it's time consuming and it's expensive to look at all of that.
Because there's so many. So what are people doing outside, scientists and maybe inside the government or inside different studies, to identify all these different disruptors and all the different effects that happen?
Well, that's a part that's been pretty weak for a long time. The identification, some have been identified clearly through research and observations, and we don't know what's going on in the rest of the world. So since, fortunately our podcast gets out around the world to many countries, my hope is that in a lot of other countries, they may be doing things a little bit more dialed in. I have read that Europe has taken a much stronger stance against endocrine disruptors than the U.S. has. And so I think that in the U.S., what I've read is that there was a program, or there has been a program, for identifying endocrine disruptors in our chemicals, and especially in the food supply, and that project, or that has been underfunded for many, many years. And so it really receives very little funding. And it used to receive more, but I believe that the funding reduced markedly about 10 years ago, and then it just has remained at this pretty low level. And from what I've read, that program is at risk of just completely going away altogether. And so it's an endocrine disruptor testing program of chemicals through the EPA. And so that's a big concern, because they're saying now we're experiencing huge budget cuts for the EPA that are threatening the existence of that program, or the ability for it to actually even function at all. So last time we were here, we actually had hope, because there was discussion of expanding that program and getting it more funding and more strengthening. And so that's when we did our last one on endocrine disruption, we were kind of positive and had hope, because there were a couple of programs that were starting to come under the spotlight for expansion. And that was a good step.
Not anymore.
Well, now one of the concerns is that, it's just limping along, and now I think it's at risk. And so without that, I don't know how they, other than like academic research, how we find out more about it, because of course the industry that's producing them is supposed to run some testing, but they're not really required to do the endocrine disruption testing. So I'm not really sure, how we're going to know. It would be good to talk to someone in that industry and find out, what the direction is there. But there are so many known endocrine disruptors, like that we already know, that we're also inundated with. So we could start there with what we already know and try to make a difference in that area.
We should talk about a few of them.
Yeah, before we do that, though, I think it's important to say that the proposed cuts to EPA, it's estimated right now that maybe 50 to 55% of that agency's budget will be cut in the next year. The fiscal 2026 budget for EPA is estimated right now to be cut from $9.1 billion to around $4.2 billion. So getting rid of about half of the budget of EPA, which is the agency that was set up to protect us from bad things in the environment. And, we talked about all the thousands and thousands of chemicals that are being produced every year. One of the key functions of EPA is to have oversight as to which of those chemicals are harmful, which need to be tested. So that whole oversight, I'm guessing there's going to be an impact when you're cutting half of the budget of EPA.
And I read that 1,000 scientists, I think, are being cut from the EPA. But one of the things last time we were on, we were excited about the Superfund sites that were expanding with the goal of eliminating the forever chemicals in our environment, at least some of them starting with targeting the PFAS in our water supply. And that was a breakthrough, because that was a great opportunity to improve the health of our population. But it appears that the Superfund sites are really at risk now of their funding also, is caught up in that cut. And I think the program is threatened to be shut down altogether. So this is where that's why people aren't talking about endocrine disruptors or our chemical environment, because there's nothing being done to correct it. And if anything, we're doing less and less now. And yet we hear a lot of conversation about health. Let's make our country healthy. But if you're talking about making our country healthy, your right hand and left hand aren't communicating, because then, we can't do that without addressing the chemical environment, including the endocrine disruptors. And if anything, rather than reducing the EPA, potential effectiveness, we want to boost the effectiveness of the EPA. We want to try to invest in methods that are going to protect our population and our future generations from the impact of the chemicals and also the endocrine disruptors contained within that. So to me, it doesn't make sense, some of the conversation that you hear, because it's just, I don't know, want to say hypocritical, but it is. It's kind of like, okay, if we're really invested in health, and I see that not just from like government messaging, but I see that also in just the medical field, and I have for years, where we so want to invest in, the acute care, episodic care, when a person is in the hospital with the heart attack, with doing the fancy, emergency procedures and all of that, and the technology involved. But we spend very little time on covering the costs of preventive care and the early detection of diseases and preventing diseases, which includes our chemical environment and addressing that environmentally.
Wow, that's troubling. But I think part of the disconnect, Dr. Cooper, is that, there were times in history that, that we didn't even know the connection between smoking and cancer and smoking and heart disease. And the fact that tobacco still kills about 400,000 Americans a year.
Shocking.
I'm guessing that there's an even greater disconnect because we can't really say that, oh, this chemical's in the environment, so that's why we have more diabetes or more obesity. There's just such a wider disconnect because the cause and effect are so nebulous to understand, right? Because the science hasn't been allowed to play out, probably because there just hasn't been funding to do it.
Well, I don't know. I mean, I think we do have evidence. If you think about it, so 100 years ago, we had the evidence that the chemicals are interacting with our hormonal system. We knew that. And since then, they have had plenty of studies that directly link exposure to very common chemicals with specific dysfunctions that occur in individuals. And so I think the science is definitely there. It's a matter of we don't look at it, just like a lot of things. When it came to when we talk about obesity and how we're still hearing the mantra, eat less, move more, put down the fork or whatever as the explanation. We're still hearing that, even though the science of obesity has been around for 100 years. We already know that's not, but no one really wanted to change their way of thinking. But I think there's plenty of research. I have seen so many research papers linking specific chemicals, like, for example, phthalates, maternal exposure to phthalates and BPA and what that can do to the development of some of the metabolic pathways in the brain of the offspring. That's going to then affect that offspring for life, if that's true. And they have shown that it does impact that. And there have been studies looking at how it impacts the reproductive status of adult males, the exposure in utero. And so these things have already been known. This is not new information. I've been in medicine for 30 years. I mean, we've been talking about this for at least 20 years. So there's a failure, here. This is not because it's hard to prove. It's not.
Right. It's a failure to communicate.
It is. And part of there's a lot of blame that's being put on certain groups, that I don't think is fair either, because if you think about what's the riskiest times in life to be exposed to these, preconception, conception, the prenatal period, during pregnancy, and then postnatal, the neonatal and the toddler years. Those are like the most vulnerable times, the most important times probably to try to do something to reduce the exposures. And so I see a lot of mothers being blamed, and I don't like that either. And that's not just by our society, because the society is ignoring the problem. It's by like the medical community that is aware of the endocrine disruptors, that's like kind of scolding the mothers. Well, now, you're pregnant, so you should not do this, this, and this, and this, a laundry list of things. And, that's not fair either, because how is someone going to avoid those things? The solutions are not readily available. And it's not that person's fault about the exposures. You can't limit your exposures in certain environments, like in the U.S. where we don't have enough controls. So we are all inundated with this. And so, but I think that is still an area where we need to focus, is where are these high risk points, and is there anything we can do?
Okay, we've heard about what we can't control and what's out there. Where is it? It's everywhere. What can we control? What can we do to make like a little dent in all of this?
Well, one of the things I've noticed with my own patients, it's kind of surprising how much difference I've noticed it make, and it's simple. It's air quality, actually. I didn't think much of it, but, with the pandemic, people were using a lot of HEPA filters and things.
Right.
And we started noticing some improvements, actually, in some of the hormone status of key hormones that are known to be affected by endocrine disruptors. Like one is adiponectin. Adiponectin is an important hormone from the body fat that is very important for reducing the risk of diabetes and cardiovascular disease. It improves our blood vessel function, and it improves our insulin sensitivity, and it increases our muscle energy metabolism. So that's an important hormone, but it's very susceptible to diminishing under the influence of things like BPA, phthalates, a lot of the common chemicals in the environment. And I noticed that when people were using a lot of the HEPA filters, the levels seemed to be going up. I also noticed when people got away from the work environment, because the workplace has a lot of industrial materials that off gas, like upholstery, carpeting, all of that. And and you can't open the windows, and there's variable filtration of the air in these different workplaces environments. But people, when they'd move to a home environment, you saw a marked improvement in that adiponectin for the majority. So since then, when we see these low levels, and I have patients check like their air filters on their furnaces and change them more frequently, use the higher MERV rating ones, maybe use a personal HEPA filter near where they work, we definitely see on average an improvement in that hormone. So that's something that I found is kind of really easy to do. And important, and it doesn't affect everybody. Some people live in a place with great air quality, but most places in the U.S., we don't have the best air quality in urban areas. And so it's a good idea to make sure your home environment is filtered. And if you do have to go back to work in a work environment, it's nice to have like the personal HEPA filter near where you work. And I think it does make a difference.
It's shocking to see how much the filter changes from white to gray and dark gray I change my filters every month, and it's shocking how dirty they are.
Yeah,
I mean, I live in a
LA.
downtown area, but it just blows my mind how much crap is on there.
Yeah. But I think also another great thing to do is just think about those vulnerable times of life. So preconception, if we have people that are thinking of starting a family that are listening, or grandparents or whatever that have youngsters that are starting a family, what they have shown is if we reduce our exposures for 4 months prior to conception, it actually makes a difference in the genetic transfer of material, both male and female. And so that's the problem, is that women are always blamed, and it's not. It's the male plays a role in this. And we need to have both the male and female, ideally, being aware of their environment for like 4 months prior, trying to make sure you're not drinking out of those crinkly plastic bottles, avoid fragrance. That is not good because it has those little plastic beads that disperse it. Keep the air quality good. Don't go and buy a new car that's off-gassing at that time. Don't go remodel your house with toxic paints and things.
Mattresses.
Yeah, things like that. And then in the meantime, that will help reduce your own levels. And then during pregnancy, the maternal avoidance of certain things is important, like cosmetics, personal care products that are laden with chemicals. Trying to keep like household cleaners, use vinegar more. Just like try to avoid a lot of the food packaging and cook more of your food. So there's definitely ways. And then planning for the baby arrival. Think about the baby's mattress, the baby's room. Do you really want to be painting with, again, things that have that VOCs? And if you have to, then just put lots of filters in there and open the windows for a long time to like air it out. If you have a mattress that's a concern, you have to like get it like 6 months ahead of time to let it off gas. Avoiding synthetic carpeting. And just making that baby environment good. And glass bottles, if you can afford the glass bottles, it probably is good. But you kind of have to think about what the baby's environment is and all their wraps and everything, anything that they're later as they get older into the toddler years, their toys. So you can make some choices that can help, that don't have to be really expensive at all either. But do we really need all the chemicals in that baby's world? And so whatever we can do there, I think those are the critical years to try to prevent this generational transfer of dysfunction. To try to make a difference and break the cycle if possible.
Yeah, I mean, you look around, if you go to any like a big box store, literally it's just plastic everywhere.
Yeah. And my son went to go get an ice cream, chased down the ice cream truck the other day, which, and was just so happy to catch the ice cream truck, and then got this ice cream bar. We looked at the ingredient. I mean, enjoyed it thoroughly. I looked at the ingredients. It's like there's not one real thing in there.
It's crazy.
So that was kind of shocking because it's kind of like, what?
No really ice, no cream.
No. So I think that that's another thing is to really think about it and teach our kids we don't want to make them obsessed or anything like that, but teach them about the chemical environment somewhat and why we have to avoid certain things. And it's going to be a real
it's hard
disappointment to them. But
right, all those things that are marketed to kids. I mean, I was shocked. I was with my niece, and I didn't know that there was a section called kids yogurt, and the kids yogurt section, which was huge in the supermarket, it's all like it's basically sugar cereal with yogurt on it.
Yeah.
And it was all sprinkles and sugar stuff with some yogurt on it.
But, that's okay if it's really just sugar and cereal and yogurt, but the question is what are the things that you don't even know what they are, that have chemical names?
I don't think it was.
That's kind of where we can think about making some choices that still taste great and still are treats and whatever for our kids, but maybe that don't have numerous ingredients that you can't even pronounce.
This looked like a lot of plastic stuff with some yogurt on top of it. Mm-hmm. It didn't look.
But again, it doesn't have to be expensive. That's the thing. I think people often think, well, you're going to be spending so much more money trying to figure out how to work your way around these things. And that could be true. That could be true that some of it is cost prohibitive to figure out if you can't use synthetic carpeting. I mean, wool carpeting is going to be like so much more expensive. So that's not going to be feasible. And so, maybe you do something in another area to reduce the environment, or use more HEPA filter, in your furnace or something. So it is hard, but there are some things that it's not about cost. It's just more about awareness.
So Dr. Cooper, as we wrap things up, I'd love to hear your thoughts on where people can go to get good information. And I just looked up the EPA Endocrine Disruptors screening website. Mm-hmm. Boy, that would be devastating if that program is shelved because of the massive budget cuts that are coming, because it really seems like it's a commitment on the government's part to identify the problem chemicals in our environment. Yes. But where can people go to get valuable information on this?
Well, I think I would go to the Environmental Working Group, ewg.org, is an organization that posts lists of products, and they do screening of some things, some consumer information, and they do have an app also. The one thing with their app, I haven't looked at it lately, but I always advise my patients not to pay attention to the nutrition part of it because I think it tries to go too far out of the scope, but just focus on the chemical part, where it has the ability to scan barcodes that can test like your cleaning products, your personal care products, and gives a rating on those. And it's a free app. So that would be a good place. But I think it is true that you'd want to go to, in your own environment, to your government sites too. So in the U.S., it is that EPA site, so you could find out what's going on with maybe the Superfund sites and that endocrine disruptor testing program. That what is it, EDSP, or on the environmental, the EPA site, maybe to find out what's going on there. But it's hard to find good information unless you dig into the scientific research. But you can, if you feel confident reading scientific papers, you can go to PubMed. PubMed is like the National Library of Medicine. And you can see, at least for free, you can see abstracts, the summary of the articles. Some articles do give you free copies where you don't have to be in an institution to access them. But if you plug in anything there to learn more about specific chemicals like BPA or BPS, which is now has replaced BPA in a lot of products, and the companies aren't saying that there's BPS in there. But if you want to find out more about their impact on metabolism, you can look into that through the National Library of Medicine. It's a free online program. And so, again, it's PubMed. But yeah, I think also consumers have a lot of power. So that may be where the biggest power lies, is in our consumerism, and whether we support these companies or whether we communicate to them of why we're not supporting them. And we put a little bit more pressure because they respond to the consumer, because they want to make money. And so that could be a marketing thing for them. And they have tried that with different things, but some of it's misleading. So you got to be careful about that.
All right. Well, this has been another interesting discussion. Endocrine disruptors are a thing, and there is science to back that up. And I think, as is most often the case, Dr. Cooper, becoming an active participant in this process is the way to move the needle, because if we all just sit back, the free market is not going to protect us. Science, and the right kind of science done, is going to lead to better outcomes. So, well, thanks you two for another edition of Fat Science.
No diets, no agendas, just science that makes you feel better.